I'm in Ocala, Florida, at Equine Medical Center Ocala, and I've been using the Lameness Locator, I think, a little over 3 years. I'd have to go back and look, but when I first started using it, to be honest, I talked to a lot of friends and kind of asked them their thoughts, and what I got from a lot of people was, well, if you're not good at doing lameness exams, I think it might be a useful tool. Or, I think it's a useful tool, for teaching students. So, and I guess, to be honest, even like when I first, talked to Dr. Keegan about it and stuff, maybe we all have some insecurities about, lameness exams are very subjective. And, as you're going through school and then after school, additional training or whatever, you just have to do lots of lameness exams. And so obviously some people have really good eyes for looking at asymmetry, and some people have to learn that and struggle more. And I think all of us have to learn it. But I think for me, there was, maybe some insecurity that I thought, well, does that mean that I'm not doing a good job on lameness exams right now? So initially I was a little skeptical. And I initially, when we got it, my anticipation was, well, if I have a case that's really difficult, I'll use it. And, or, a horse that's just poor performance and they're not really overtly lame, maybe it'd be good in that scenario. So for me personally, what I've found over the past few years, the transition that's happened is I would use it, on select cases, which actually, and you talked about, not being cumbersome, not slowing down your lameness. If you do it the way I was doing it initially, it slowed down the lameness. Because what I'd do is I'd look at the horse, do a passive exam, jog them, and go, oh, maybe I need to put the lameness locator on. Take them back in, put the lameness locator on, and repeat a bunch of stuff. And it was just a big waste of time. And so what I found was that a lot of the things that we were discussing that are going to be talked about later this afternoon, a lot of the things that like compensatory lameness / false lameness / asymmetry, whatever you want to call it, it's huge, and as you're doing a lameness exam blocking a horse's forelimb and you can't get him to block, I can tell you that I've done it in the past, and hopefully I won't do it as much in the future, and I've seen loads of horses referred into me that were primary hind limb lameness that someone had blocked their forelimb over and over and over. And so at least you have to, always ask the question, is the horse neurologic? Does the horse have a hind limb lameness? You're blocking their forelimb. And I'm sure you guys have all done that. You've asked those questions in your mind as you're blocking a horse you can't get to block. But the beauty of the lameness locator is that as you use it and you get comfortable with it, I think it really helps you get a better understanding of compensatory lameness, and I think it helps give you a better eye for looking at lameness personally, because it's almost like shooting plain films, shooting radiographs and doing a full set, and you go, oh man, I wish I could get my flex lateral fetlock better. And then when you have a DR and you go, boom, oh, I need to do that. To me, that kind of instantaneous, result helps better your eye. And it's really a lot of what we're doing when we do lameness exams is it's the same thing as shooting radiographs. It's developing an eye for looking at asymmetry instead of, looking at how you're positioning the horse. So, and then also we discussed variability. Variability, and you'll see on the case I'm presenting, for the forelimb lameness on this horse, there was the standard deviations were big, and it can be discouraging if you have a horse that doesn't act up. But I think that's where, maybe the weakness of the system in some cases is variability. And so there are some horses that you just can't lunge. They're going to throw their head around, and it's just not useful. And so I still lunge those horses, and I still watch them go, but I just won't use the lameness locator or what it's telling me as much. So personally, the way I use it now is I use it not on every lameness, but I use it on the majority of the lameness exams that I do. A lot of the lamenesses are referred in. They've been looked at by another veterinarian or more. And what I do is I do a passive lameness exam. I put the lameness locator system on them. I take them out, and we have interns, and so usually the intern operates the tablet, and we jog and flex the horse. I still do. I act like I'm doing a lameness exam without the lameness locator. I jog the horse. I develop my opinions basically without running over to the tablet over and over, unless I'm not seeing much. And then I kind of use the lameness locator as a supplement. And that's how I do it. I don't know if that's right or wrong. And I've tried to do that. Initially, I tried to do it so that I wouldn't be biased by what it was saying, because I didn't know how useful it's going to be. But what I found is, by seeing really subtle lameness and looking at it and going, oh yeah, no, it's agreeing, or no, it's not agreeing. To me, it's helped develop. I think it's helped make my eye better at looking at lamenesses subjectively. So I'm just going to present a case. I wasn't really sure if I should go back and try to look at horses that had really subtle lameness, or horses, where there was just poor performance, and use the lameness locator on them and identified a lameness. I picked this case. It's really, I looked at this horse not that long ago. And so this horse came in. It had been looked at by another veterinarian or two, but the trainer brought the horse in. It wasn't referred in specifically. It was a mare that was a 4-year-old reigning mare. She'd shown successfully as a 3-year-old, and had traveled around and done pretty well. And she was being brought in because the trainer was convinced that she had stifle soreness. They said that she was off behind for a few months, but then as a 3-year-old, they also said that they had some training issues with her. And she had been recently, her hocks had been injected. I don't remember, maybe a month or two earlier, her hocks had been injected. They said it didn't change the lameness. The trainer said, oh, I'm pretty sure it's her stifles. I want to have her stifles injected. And so I looked at her, and she, I'll go through the passer exam. She did have some stifle effusion, but basically I said, maybe we should jog her and flex her and, make sure that we're on the right track. So during the passive exam, just, going over her legs, she was pretty positive to tendon palpation, basically on all 4 limbs, kind of, I call them fragile flowers. Basically she responded, at everything you pushed on. She didn't like it very much. Her tendons and ligaments grossly palpated normally. I thought. I didn't feel any thickening, and she had mild bilateral coffin joint effusion in front, and she was mildly positive to hoof tester's central frog, and the way I recollect, a little bit wall to wall, going across her heel. She was similar to hindlimb palpation. She did have some mild medial-femoral tibial joint effusion, and was negative hoof testers behind. I didn't appreciate that she was positive proximal suspensory palpation, but once again, everything that you pushed on, she wasn't real crazy about. So I put the lameness locator system on her and took her out. And when we jogged her, just me watching her go, she was very left hind lame. I call her consistently lame in the straight line, and then also when circled. So I kind of do a modified AAP lameness grading system, so 3+, meaning she was very lame in the straight left hind. She was a little bit worse when I watched her go to the left, and then not quite as bad going to the right. So now I'm going to pull up the report for the lameness locator, and I'll go through some of the things that that Dr. Keegan was talking about. So number one, if you look, the standard deviation for her head, there was a lot of noise. And I could go back and try to remove outliers. What I wound up doing was I gave her a CC of ace-promazine and re-jogged her. And I believe this is even after I did that, because I had two straight line reports. And this one I believe was after. So she's still, she was one of these horses that when she's jogging, she would look around at everything and kind of put her head up and down. And so once again, that's the, I think that's the variability that sometimes, you can have limitations with. If you look at, accumulation of rays, there tends to be more accumulation of rays, towards the left front, and the left front A1, A2 value is bigger than the right front, but you can see the standard deviation is big, and the max diff and min diff are below threshold. And then obviously, if you look at the hind limb, you can see that there's a huge accumulation of rays. And when I say huge, I mean if you look at the the size on the left hind, and you don't see anything on the right hind. And if you look at that says 0.69, so that's hard to read. But if you look at the A1, A2 value, it's much greater than 0.17. And then the max diff and min diff are much greater than 3 millimeters. So, and to be honest, I don't use I haven't gotten accustomed accustomed to using this a lot. I do look at it, but it's not something that I use a lot with the expert system. But if you look at it, it's saying that basically she's sound in front, and she has a moderate, severe, and what I would classify as severe left hind lameness. And then I routinely do a split screen, and we'll talk about this more later, but I do a split screen and just jog them in hand in a circle on asphalt. And if you look, there's really not an accumulation of rays going to the left. And I always go circle left first. I just do my technician who jogs, do the same thing every time. So I don't have to say anything, but he jogs to the left and jogs to the right. And if you look at the left hind lameness, it's about the same, or maybe just a little worse. If you look at max stiff mid hip, it's really about the same going to the left. And then going to the right, you know, you can see a difference in the rays on the forelimb. You have more going, you know, towards left front push off. But once again, you know, these values are pretty close to thresholds. And once again, you can see standard deviation is big. You know, I could probably remove that outlier. But bottom line is the horse is left hind lame. So based on what the trainer was saying, and she did have some stifle effusion. And I put flexions on this. I didn't do a pre-jog like for 8 steps in the straight. You know, I just jogged her down and back. But my interpretation of the flexions, just watching her, is that all the flexions were positive. Mostly the stifle flexion, which is I pulled her leg back behind him and up. I graded it a 3 out of 5 response, meaning just, you know, moderate, strong moderate response to stifle flexion. So based on the stifle flexion, she has some stifle effusion. The trainer's convinced that it's a stifle issue.
Eric, I didn't mean to interrupt you,
No, go.
but on your data, just on the data tabulation on the central column there, you've got 5.24/11.8 max. Okay, now what?
Right there.
Oh yeah, what? Just could you slow down, please, and just tell me
Sure.
what those numbers mean?
So the maximum differential is you know, the comparing left front to right front upward movement, and so it's 5.2 millimeters. You're looking at this right here, correct?
Yes.
And the standard deviation are these outliers where basically she's still kind of tossing her head side to side, looking around. So
All right, so I got that. So then why? Then it says max, and then it says 5.4.
so over here with the split screen, it's,
Okay, so that's that data and this that data.
Yeah,
oh,
this
okay,
is
now I-
so this is saying in a straight line. So sorry, I should have explained
All
it
right.
better. So it's on the left side. So with all of these, you know, what I should have done is should have jogged the horse for 10 or 12 steps. If you look right here, you know, we jogged the horse after I flexed it. I jogged it for 16 strides. And what I usually do, and I don't know if it's correct or incorrect, but when I flex them, I'll jog them, and when their flexion when they start jogging out of the positive response to flexion, I'll stop. So a lot of times if I flex a horse and they jog them and they're negative, I mean, it's pretty obvious that they're negative, and I don't think I think the lameness locator for looking at flexions is useful, but if they're negative, they're, you know, and you can pretty well say they're negative. So I don't jog them 12 strides even.
Okay. But if it's below threshold, do you just kind of sort of in your mind just kind of throw that data out? I mean, let's say that if it's below threshold, like 5.2, below threshold,
Correct.
we're
Well,
not gonna-
especially if you're seeing a hind lameness like this. If you look at a horse and they're sound behind, and you're looking at a horse that has poor performance, or you're looking at him and you're saying, I don't really see much lameness, and you saw this, then you'd need to try to figure out if you can tighten up your standard deviation somehow, whether you need to give them, try to jog them in a different environment, or who's jogging them, and some horses just aren't going to jog well.
So what did 1cc Ace do to your?
Oh, it helped her a bunch when we first started. I mean, I said we almost can take the lameness locator off if we, can't get her better. So it made her better.
By better, you mean, what do you mean by better?
So
less lame or more lame?
No, less variability.
What does
So-
it do to your severity or lameness when you give a horse ace promazine?
When I've given horses 1 cc of ace promazine, I've not appreciated that it does much of anything to their lameness. Matter of fact, a lot of horses, it exacerbates their lameness in my
They
mind.
get worse.
So, and I guess I
Okay.
kind of learned that from Marvin Beeman at Littleton. You know, he'd say, Dr. Adams, draw 0.9 cc's of ace promazine, please. And so, you know, I did that a bunch of times, and I've done it a bunch of times since. And I've had a lot of horses that, you know, they're just, whether I'm using the lameness locator or not, they look high as a kite, and you can't tell much of anything.
But so,
And
the
so,
question is, does it makes them lamer, ace promazine? Sometimes.
I think
Or
with
can
the
you
human
generalize?
eye, I don't know about with this. I think
Yeah.
with the human eye, my appreciation is that it's easier to see asymmetry.
Under
so
the influence of
when you give a horse that is acting up, and I know Dr. Keegan will give, you know, extremely small doses of detomidine. You know, at least he talked about that previously, like 0.1 cc's or something.
Some people, I know of at least 3 different places that have done research projects on using this equipment and measuring what happens after you sedate, both using ace-promazine and detomidine. And the conclusion, bottom line, is that it doesn't make a hill of beans difference for the lameness. Sometimes the lameness will get worse. Sometimes it will get a little bit feathered, but the amount of change is very small. And it depends on the horse. If the horse is really excitable and like really excited, then it actually makes the lameness get worse because the horse is not feeling the lameness because its adrenaline level is so high that, you know. But if you take it and you sedate a horse that's very calm and that, you know, you potentially make it a little bit less. So it depends on the horse. But the more excited the horse is, the less likely you're either going to see or measure the lameness.
But, and the purpose of putting this side by side was just to say, okay, you know, jog the horse and then flex the horse, and you can kind of, you know, you can compare A1, A2 values, max diff, min diff. I mean, if you look at these values, you know, what I should have done was jog the horse about the same number of steps, which we'll talk about later this afternoon. But
what's A1, A2?
it's comparing, you know, movement of the, like the front end or the hind end, the abnormal movement versus the normal movement.
That's the asymmetry. That's just a
Correct.
measure of asymmetry.
Yeah, and so you know, the threshold normal values should be 0.5 on forelimbs and 0.17 on hind limbs. So these are huge values. So once again, that's why when I was looking at picking a case, this case was obviously lame, and you can make an argument, well, you didn't need the lameness locator to block this horse. Yeah, certainly, you know, we could have blocked this horse without it. But I think as we go through it, you'll see, you know, even with this horse, you know, the compensatory or false lameness comes into play to some degree. So, so I blocked the horse's medial femoral tibial joint and femoral patellar joint. I didn't block his lateral femoral tibial joint. And there was really minimal change. So to my eye, there was no change. And with the lameness locator, you know, it said that it worsened the push-off lameness. And so, you know, if you look at the red section, that's the push-off lameness on the hind limb. If you look at the A1, A2 value, you know, it is a little bit higher. And if you look at the max diff, min diff, at least the max diff is a little bit higher. But basically, the block did not help the horse. I mean, the horse was still lame. So then I did an abaxial knee block on the horse, and once again, you can see some variability when you're doing blocks on how the horse is moving in front, but you know, once again, it didn't improve the horse significantly. And so the left hind blocking worse than the left hind impact lameness, and that's if you're looking at the green section, how it's bigger right here. It did not improve the push-off lameness.
So is Eric, on the left is your baseline and then the right is post block?
Yeah, so what I'm doing each time, good question. So this is baseline, so straight line. This is without any blocks.
Okay.
So if you look at blocks, and then this is after I block the horse's stifle. And then each time when you compare, you know, you especially with the expert system, what you need to do is you need to compare to the previous block. So you don't compare to baseline each time.
Okay.
You compare to the previous block.
Okay.
So because it's looking at the improvement from the previous block. Did I explain that correctly?
Additive
Yeah, I do.
effect.
What's
Right.
that?
There's an additive effect.
Correct. Yeah.
Yeah, sometimes I go back and look at compared to the baseline, but.
Yeah, I will too. I mean, you know, like when you get, you know, as you're making improvements, you can go back and, but as far as the expert system, you know, it wants to compare to the previous one. But, and so, you know, this is, right here is after stifle block, and then after stifle block and I have axial nerve block. So minimal change. And then I did a low 6 point, and you can see right here that, you know, we went from, once again, the standard deviations are big, but they're closer to the max diff and min diff. But when I did this block, I could see a little bit of a mild right front lameness. And the lameness locator was saying mild right front impact lameness. If you look at the A1, A2 value, it's just right at threshold. And max diff is just slightly under, and min diff is over threshold 2 times, but the standard deviations are bigger. And then as I jogged this horse down, or had the horse jog down, you know, to me it looked better when it started, and then when it got towards the end and came back, it was pretty left hind lame again. And if you look at the raise, you know, that's basically what's going on. So, you know, the expert system is saying the left hind blocking improved the push off lameness by 51%, and that's, you know, that's this red value on the hind limb lameness. It didn't improve the impact lameness. So, you know, just subjectively during my lameness exam, I thought the horse was maybe 30% better, but definitely not sound. And then after I did the low 4 point, I blocked deep branch of the lateral plantar nerve, and you can see a pretty profound change in the forelimb lameness. And after I did that with this horse, I mean, this horse now had a big right front head nod. And I was like, wow, that's pretty interesting. And you can see what it did with the left hind lameness. So the left hind lameness, the A1, A2 value went from about 0.6 to just slightly under threshold. So 0.17 threshold went to 0.16. And if you look at the max diff and min diff, you know, they dramatically improved. And as I watched, I mean, it correlated what I was seeing, where when it went down, it looked pretty sound, and it looked like it switched. And as it came back, it looked just a little bit left hind lame again, but it was pretty subtle compared to when I started. So now, if you look at the bottom, the expert system is saying there's strong evidence. And if you look at the standard deviations now, you know, they're still big, but they're under the max diff, min diff. So it's saying that there's strong evidence of moderate to severe right front lameness. So, you know, if we use the 4-strike rule, there's an accumulation of rays, 1 strike. The A1, A2 value is much bigger than 0.5. It's now almost, you know, it's 1.4. So there's strike 2. The max diff and or min diff are greater than the threshold of 6 millimeters, so there's strike 3. And the standard deviation, although big, is under the max diff, min diff, so there's 4. So there are 4 out of 4 things saying the horse is right front lame. And if you look at the hind limb lameness, you know, definitely the horse was improved. So next I did a right front palmar digital nerve block. And so if you look up here, this lists the blocks. There's deep branch of the lateral plantar. So right front palmar digital nerve block plus all those. And it dramatically improved the right front lameness. So if you look at the max diff, or sorry, if you look at the A1, A2 value was 1.4, now it's 0.5, and then these all went down. So it says right front blocking caused 97% improvement in the right front lameness. And it's saying there is strong evidence of mild to moderate right front lameness. So you can see that it's still, see this little circle going around. That's the 6 millimeter threshold for the max diff, min diff. So there's still some rays or some rays that are larger. So the horse still had a mild right front lameness, but it was dramatically improved. And after I did that, the horse was, you know, just even watching with your eye, the horse was significantly right hind lame. So then I just blocked the deep branch of the lateral plantar nerve on the right hind. So if you look right here, this is the previous, this is before blocking, and then this is right hind. I'm blocking deep branch of the lateral plantar nerve, and it improved the right hind lameness significantly. And the horse went back to being a little bit left hind, and then you can see right front. So, you know, things to think about, and we'll talk more about this later, but for sure, you know, I think it's interesting if we look at left hind lameness, you know, which has the potential to cause compensatory left front lameness. So you can see right front lameness. Once you get rid of this, then you can see you know, a change in the right front lameness. So that's what I was talking about earlier. When you're using this, you know, to me it was a bit mind blowing, the degree of compensatory lameness and how dynamic and complex, you know, horses' movements are when they are multi-limb lame. And so many of the horses we look at are multi-limb lame, and I think when you're not using this system, you know, most of the time what I found myself doing was, you use the 70% of the horses 70% better. Okay, I'm going to go after that. And I'm not saying it's right or wrong. I'm just saying I do think you can get pulled into a place with using the lameness locator where you try to get a horse too sound and you spend too much time on them and kind of lose the trust of the client too. But bottom line is the horse, I did take radiographs and ultrasound of the left hind fetlock since it got improved with the low 6 point, and I didn't find any abnormalities. And I did take radiographs of the left hock, because I usually do if a horse blocks to a deep branch lateral plantar or origin suspensory block, and they were normal. And you can't see in here because the lighting's not good, but on a DP proximal metatarsal region, there were several areas where there was a lucency with surrounding sclerosis in the proximal cannon bone of this horse. And then at the origin of the suspensory was huge. It measured 2.2 centimeters squared, I believe, and 2 centimeters squared on the left hind being bigger than the right hind. And there was loss of fiber pattern. And then just down, so, you know, 16, 18 centimeters distal tuber calcaneus or zone 2B, whatever you guys use. On the left hind, there was more of a focal loss of fiber pattern. And I shot foot radiographs, and there was significant foot imbalance. There was a small lucency in the sagittal ridge of the navicular bone, which didn't really show up on the skyline. There were increased lucent bodies in the distal border of the navicular bone, mild proximal border remodeling. So basically I diagnosed bilateral proximal suspensory desmitis, severe left hind, moderate right hind, with palmar foot pain, mild navicular degenerative changes seen radiographically. I did plantar fascia anerectomy, and we're, you know, doing some corrective shearing, and this horse is like, I don't know, a month out from surgery. So anyways, I probably took up too much time, but this key points we already talked about them basically. I think that it allows you to have some objective data and objective data concerning nerve blocks. And I think it's invaluable at trying to identify compensatory lameness, and at least it'll open your mind more to compensatory lameness and the complexity of it. You know, whether, like you were talking earlier, whether a hind limb is causing a forelimb or a forelimb is causing a hind limb. But at least, you know, and I know we all think about that anyways, but I think it really makes you think about it. And I do find it's useful in illustrating the reports to clients, although you have to do it, you know, with some caution. So, you guys have questions? That's a tarpon. It looks like a minnow, but it actually, it's about a 150-pound tarpon. That's some of the benefits of being in Florida. Get to put up with the heat, but you catch nice fish. Well, thanks for your attention.
Thank you.
Uh-huh.
Do you use it on the subsequent evaluations? So like in this horse that you've inserted your own, when you follow that horse to see if that reflected work?
Yeah, I do, and I think it's great for that because it's so easy to say. I mean, I think the AAP lameness grading system is flawed, and I mean even if you look at the European systems where they're grading out of 9 or 10, I mean I think it's subjective, and so it's nice to have objective data. Like a really good example was a horse that had a type 2 P3 wing fracture hind limb there that kicked something. And they'd done all kinds of corrective shoeing and whatever, but the horse came back in and I looked at the horse and I was like, man, the RDVN said the horse was better. The client wanted to be putting it back into training. I looked at the horse and I was like, it still looks pretty lame to me. And so I pulled out the Lameness Locator and I had from like 10 months earlier, I had that data, and you can compare it side by side, and you show the client, listen, the horse is too lame to be going into work. So no, I think it's very useful for something like that. I've not used it a lot on pre-purchases, and I don't know. It'll be interesting, this afternoon to talk about that. I think, sometimes I think, almost like doing MRIs on, expensive warm blood suspensories for pre-purchases, and I don't know. I think sometimes you can open Pandora's box a little bit.
I mean, anything you do in a pre-purchase evaluation can do that.
Yeah.
So we just got to know how to handle it.
Yeah. And so I don't know.
Pre-purchases, I say, I look at the report and I take everything into consideration, and just because the report says something does not mean that the horse is right. It's just like taking an X-ray of a horse and seeing something, does that really mean that's going to cause a horse body? This is why we're professionals.
Right.
We have to read between the lines.
Wait, you just said, just because the report said the horse is lame, doesn't mean the horse is lame. I mean, I'm not
But
trying to be.
Don't confuse the term.
It's what we.
Lameness.
It's
with-
Asymmetric.
It says there's evidence.
Okay.
It doesn't say that the horse is lame. It says there's evidence.
But it is asymmetric.
Yeah.
I mean, that the technology detected asymmetry of movement, so that exists.
Yeah.
Now, whether or not that's of clinical significance, that's your judgment, correct? What were your 4 points? What was you had 4 things: A1, A2, max, min, less, greater than the threshold, and the standard deviation. What was the point number 1?
So accumulation arrays. So when you're
accumulation
looking-
arrays.
Yeah,
Okay,
when you're
got it.
looking at the
All right,
diagram.
yeah, I got it. Okay.
Yeah, you're looking for an accumulation of arrays.
Okay. All right.
Because if you don't have that, then if you don't have that, I mean, maybe they're like this horse. The whole time I was watching this horse had noise, and once again, like some horses, when you free lunge a horse in a round pen, even if you put a lunge rope on, some horses, it's in my mind, is totally useless to put the lameness locator on because there's too much noise. So the nice thing about the human mind is we can look at it and we can just disregard all that. That's the beauty and the weakness of the lameness locator, in my opinion, is it can't do that. The reason why we want it is it can't do that. It can't do that at 6 o'clock on a Friday night when you've done 10 blocks on a horse and you're going, man, I hope this one makes it better. It's better. You think that's better? So, because, we're humans.
How does the ground surface affect your data? I mean,
Where I'm jogging the horses, there's a slight tilt. and
I'm not talking angularity. I'm talking hardness of surface.
That's
Cement
right.
versus grass versus sand, different
Yeah.
racing surfaces. Like synthetic surface, turf.
I think it affects. If it affects the lameness, I don't think it affects necessarily just asymmetry, but if it affects the lameness, it's going to change asymmetry on the lameness locator. I mean, the way I use it is I do the lameness just like I was going to do it with or without it. So I take the horse out, I jog it in the straight, I jog it in circles, I flex it, I put it in the round pen, and I lunge it. And I do that. That's what I've done. This is the way I've been trained. That's what have done for a while without the lameness locator. So,
I mean,
there
my
are some
question
horses.
specifically question is okay, so we move the horse, say he's lame. say on a hard surface. So then we take them to a less hard surface, wherever that might be, and we move the horse, and we say, oh, a lot better on a soft surface. Now, is that, in your clinical experience, has that been documented with this technology? I mean, does that agree?
Oh, yeah.
I mean, if
There are horses that I look at where I don't agree with the lameness locator, but you know, whether I'm looking at stride length or whatever else, horses that are club-footed, you know, there's some horses where the lameness locator's saying they're not really lame. When I look at them, I go, well, they look lame to me. But if you're saying, does it correlate? Like if I take a horse that has bilateral palmar foot pain in front, block to a PD, and you put them in soft footing and they look a whole bunch better, I mean, the lameness locator will say they look better. Now, once again, if you're looking at A1, A2 value, and the thresholds, those are developed for in the straight line. So you have to, you know, you have to, when you're watching them go in a circle.
Does the technology generate the A1, A2 value? That just is with the threshold, that's just part of the standard data that comes with this exam?
Yeah, my understanding is, you know, looking at a big group of normal horses,
Okay.
what should they be?
All righty.
So,
Okay.
Can I ask one more question too? Have you used it with a rider on the back?
I have limited, yes,
And?
and it works well. Yeah, especially horses that, you know, there are some horses that when you collect them, you can see their lameness better, and so I think in cases like that.
The last part of the laboratory afternoon was there's this large study, 88 horses, where we measured with and without a rider, and to measure the rider activity also with the sensor on the rider. And were some consistent effects that you can so I mean, to put it in a nutshell, when the rider's posting on a leg, it makes the horse appear like it is lame in the left hind. Or if the rider's posting on the right, it makes the horse appear like it's lame in the opposite. It's very consistent. And if you take the horse in a circle in that direction, it amplifies.
How does weight of the rider affect?
Well, when we look at trotting in a straight line without a rider to trotting in a straight line, sitting with the rider, sitting with the trot. In general, when you looked at the entire group of horses, there was no significant difference.
In asymmetry?
But when you look at individual horses, there were some horses where the increased weight made the lameness come out.
What about just the saddle? Some horses will change. Have you seen? Yeah.
Okay, did you want to say something?